Kimball was amazing, and I just greatly appreciate his passion and dedication to addressing this pandemic around food in our country and society. I'm Scott Lammie. I'm the Chief Financial Officer for the UPMC Health Plan, and have worked in the healthcare industry for the past 30 plus years. And it's very well known to those of us that work in this industry on a day-to-day basis that there are two startling facts that those of us in the industry are constantly frustrated by. One is the fact that 80% of the determinants of health status for all of us have to do with psychosocial, socioeconomic, and environmental conditions and have nothing to do with the delivery of healthcare services. We are the provider system that is dealing with the outcomes of a lot of bad things that we do, and we're dealing with the failure, as Kimball had mentioned, the failure of our food industry, the failure of public health, the failure of public education, the failure of a lot of things in our society that are really driving a lot of problems that are, it's really a pandemic. The other fact that is very well known to those of us in the industry is that 75% of all healthcare costs that we incur, which is approaching 20% of our gross domestic product here in the country, 75% of that cost is related to chronic disease conditions that are related to preventable lifestyle behavior issues and controllable environmental conditions. So if we could address our lifestyle behaviors and the environment in which we all live and work and basically exist, we could basically eliminate the healthcare crisis in our country, improve the health status of our people, our productivity, and all of those issues. And the other point that is great with what Kimball is focused on is that one of the main drivers, I think it's the 80-20 rule, 80% of those chronic disease conditions are related largely to the overweight, obesity, poor nutrition, and some sedentary behavior, but most of it is related to what we eat and how much we eat. And if we could address those issues and really start to turn back this chronic disease pandemic that we have in our country, diabetes in young people, congestive heart failure in young people, it's really a crisis that I applaud it. We, all of us in this room, applaud the great work that Kimball's doing to help continue to bring focus and solutions to that crisis in our country. So thanks again, Kimball, for your great work. I'd also like to, there are as Greg and others have mentioned already, Pittsburgh is the neighborhood that Mr. Rogers helped create, and it's taken a village to put this conference on, and there's so many people, most of whom are recognized, acknowledged in the program, but I'd just like to thank a few folks. First of all, Grant, thank you for moderating this great session with Kimball, and thanks to our staff again. I know we've already thanked them, but Kate, Samantha, Matt, the folks at the Forbes Funds and the Greater Pittsburgh Nonprofit Partnership, thanks for all of your great work in helping to put this conference together for all of us. Thanks to all of our sponsors who are outlined in this publications, both our financial funding partners and those of you that have provided in-kind services and support to all of us. Thanks to Carol and King Communications for the great work in helping us to organize and put on this great conference. Our co-chairs, Susie Shipley and Greg Baer, thank you for your great efforts. Greg, thank you for heading our program committee and all the program committee members. I think we hit it out of the park today with this conference, with just the substance of the subjects and the sessions. And so let's thank all of our folks that helped put that together. And we have our speakers, our panelists, performers, moderators, all of those great folks, the planning and the fundraising committee members, all their advice and counsel, John Lydon and the GPNP advisory committee, and all the great work you've done. our Forbes Funds board. I have the great privilege to serving on the board with Chip Burke, who's our chair of that board, and thanks for everything that you're doing to help capacity building within our nonprofit community. The Pittsburgh Foundation, Allies for Children's, lots of folks here in this room and outside of this room that came together to really put on this amazing conference. And so thanks to all of you for those great efforts. And before we adjourn, I'd also like to remind everybody, as we started this conference, that we handed out those materials to ask you to engage aggressively with our state legislature and our governor to make sure that we pass a budget very soon. And as we leave today with all of this great work that we've done today and just the report out of all the amazing activities that are going on to help remake the world through what we're doing here in Pittsburgh and creating Pittsburgh as the shining example of how we should live and how humanity should exist throughout the world. And I know Kimball's going to come here to Pittsburgh to help us continue to build that capacity for the rest of the world. So it doesn't end here, it begins here, and I'm the last speaker, and we're between us and the reception that's following, just up the hallway towards the reception area. We're going to basically spend the next hour and a half dining and engaging in continuing conversation and developing those action plans for all the follow-up that we're all going to do as we leave this exciting conference today. So on behalf of myself, UPMC Health Plan as a sponsor, and all of our other sponsors, thanks for all of you that all of you do every day to make Pittsburgh the special place that it is. Thank you.